Hello doctors, welcome back to our channel. Today we are going to see about basics of ECG. Let's get jump to it. Okay, ECG, electrocardiogram. It is a device which records the electrical activity of the heart. It is a simple non-invasive procedure that helps to find the majority of the heart problems. Before knowing about ECG, you should know about two things. One is action potential of the heart and the next is vector. Let's see about that. Assume this is a cell. Cell is under rest. So here resting membrane potential will be minus 90 millivolt. Now there is a stimulation, few sodium ions influx, which increase the positivity of the cell. Once it reaches the threshold level, here it is around minus 70 millivolt. The cells rapidly opens voltage gated sodium channels. So the sodium influx occurs. Once it reaches the peak, cell starts to open the potassium channels. We all know potassium concentration is higher inside the cell. So the potassium efflux occurs. But at the same time, calcium channels open and influx of the calcium occurs. So there will be a steady line maintained, which is called as plateau phase. In few milliseconds, calcium channels closes, but the potassium channels remain open. So potassium efflux occurs. In this graph, we seen depolarization, plateau phase and repolarization. Cardiac cells are connected with adjacent cell by electrical window, which is called as gap junction. From this window, electrical activity passes from one cell to another cell. So basically everything that we seen here is called action potential of the heart. To record the heart activity, we use ECG machine. This uses the basic principle of galvanometer. I hope you all have been seen this galvanometer in your physics lab. It shows the electrical activity by deflecting its needle. Okay, no need to go so deeper. Just remember, if the positive current move to the positive side or the negative current move to the negative side, the deflection will be positive. In other case, the positive current move to the negative side or the negative current move to the positive side, deflection will be negative. One more thing, if the cells are fast conductor, there will be a fast deflection. If they are slow conductor, there will be a slow deflection. Generally, our body is a good conductor. That's why a small electrical activity produced by the heart can be recorded. Let's see what happens if we connect the negative end to the right hand and the positive end to the left leg. When there is no electrical activity, there is no passage of current. So no deflection in galvanometer. So we see a isoelectric line. In next few milliseconds, there is a special cell called sinoatrial node, which has the power to start its own impulse. So the SA node passes the impulse to the atrium. If you see here, the mean vector is down and leftward. As we see here, depolarization of the atrium, which means the positivity of the cell. So the positive current move to the positive side. So the deflection will be positive and we see P wave. In next few milliseconds, impulse reaches the AV node. It has a special characteristics called slow conduction, which happens due to resting membrane potential of the AV node is minus 60 millivolt. This helps to give the time for the ventricular filling. So in ECG, we see isoelectric line due to the small vector. In next few milliseconds, impulse passes from AV node to bundle of His. Bundle of His is a fast conductor, especially in left bundle of His, having a branch which passes the impulse to the septum. So the septal depolarization occurs. If you see here, the mean vector will be small upward and slightly right. The depolarization leads to positivity of the cell. So the positive current moves towards the negative leads. This leads to negative deflection of the galvanometer. So we see Q wave. In next few milliseconds, bundle of His passes the impulses all over the ventricle by Purkinje fibers, which means the major ventricular depolarization. But the mean vector will be large, quick on downward and left sided. Because left ventricle impulse are more dominant. You all know the reason because the left ventricle needs more power. So we see R wave. In next few milliseconds, basal depolarization occurs. So the mean vector will be on the right and upward. Again the positive charge move towards the negative leads. So the negative deflection of the galvanometer occurs. That's why we see S wave. At last, ventricle repolarization occurs. If you see here, repolarization starts from the outside to inside. Do you know why? Because during ventricular contraction, inner layer of the blood supply are squeezed in between the muscles. So the repolarization starts from the outside to inside of the heart. So the mean vector on right and upward. But if you see here, the repolarization of the cells lead to negativity of the cell. Negative current move towards the negative leads. So the deflection will be positive. If you still don't understand, just remember this. If the same current and leads, positive deflection. If opposite current and lead, negative deflections. So we see T wave. Okay, here comes my question. What is this pink line between the S and T and why it is happening? If you know the answer, comment below. If you want to know, follow this video. It happens because after the basal depolarization, all cells become positive for a few seconds. So there is no movement of current. So there is no deflection. Next we see about each wave, segments and interval. First, waves. P wave duration is less than 120 milliseconds. QRX complex duration is 80 to 100 milliseconds. And for T wave, most important to know the height than the duration. In limb leads, less than 5 mm. In chest leads, less than 10 mm. Next comes the segment. We can see PR segment, which happens due to AV delay, and the ST segment. Both are isoelectric line. Next comes interval. Mainly we have to know PR intervals. It starts from the P till starting of the Q. It is nearly 120 to 200 milliseconds. And QT interval. It's from starting of Q till ending of T wave. So basically QT interval is complete ventricular depolarization and repolarization. Q3 interval nearly 360 to 440 milliseconds. Okay, you all have this question. Why I am saying in round number of each duration? It's because I am trying to simplify to remember. If you see, you can easily get confused with 0.08 and 0.8 during exam. So better remember in this way. Till now we seen about electrical activity of the heart. Let's see about the graph paper which records it. Each graph sheet will have big and small squares. Basically 300 big squares equal to 1 minute, or you can say 300 big square equals to 60 seconds. So 1 big square equal to 60 by 300, which means 0.2 seconds or 200 milliseconds. Each big square has 5 small squares. So 1 small square equals to 0.04 second or 40 milliseconds. From our previous discussion, we know about duration of the wave. So the P wave is 80 to 120 milliseconds, which means nearly 3 small squares. I hope you are getting my words. 1 small square equals to 40 milliseconds. So 120 by 40 is equal to 3. Then QRX complex around 80 to 100 milliseconds, which means around 2.5 small squares. And we know QT interval, it is 440 milliseconds. So around 10 to 11 small square are 2 big squares. I hope you understand all about the basics of ECG. That's all for today. Thank you for watching. Hope you see on the next video.